I'm going to be talking about Ben, who is a 22-year-old male that was diagnosed with type 1 diabetes as well as ketoacidosis. His labs found that he had uncontrolled blood glucose, very high urine glucose, and ketones found in urine, which resulted to very low insulin levels and unmanaged diabetes symptoms, which would be the reason for all of his symptoms of dizziness, drowsiness, from walking into the ER. Directly, weight bias was not seen in Ben's medical chart. However, weight bias is a very critical thing to be aware of as a dietitian or any healthcare worker in that environment, because professionals can create assumptions about a patient's physical appearance and associate it to their health or what's going on. In this specific case, maybe an example of this could be a healthcare worker may make assumptions and biases on how the patient looks and their diet based on their weight and the type of disease like diabetes. So a healthcare worker might look at the patient and make assumptions on why they have diabetes and based on their weight or what they look like. But as a nutritional professional, I would use my knowledge and awareness of weight bias and explain to my fellow healthcare workers that are in my environment in the situation that type 1 diabetes is a condition not caused by your diet, lifestyle, or weight, and it is autoimmune. It is important to be respectful to the patient and keep the priority being the focus of the disease and the management of the disease rather than what the person physically looks like. I would counsel the patient by using motivational interviewing techniques. My main focus would to make sure that the client is comfortable, make sure I'm understanding their experiences and really focusing on their concerns that they may have while managing diabetes. I would avoid commands and forceful language and use more open-ended questions, affirmations, and summarizing the information for them. Some areas to focus on would be learning importance of counting carbs, especially with a disease like type 1 diabetes, talking about potential eating barriers, setting realistic goals, and overall management of the insulin and diabetes as a whole. A strategy to use to limit weight bias during counseling would be increasing empathy through education and perspective. An example of this would be using techniques like obesity simulation suits during healthcare trainings. This can really help make more healthcare workers and the people that are going to be around this environment aware of what weight bias is and techniques and ways to give more positive outlooks on situations and avoid any assumptions or bias with patients.